everyone. Welcome back to Misconceptions. This conversation is going to be with a colleague and friend, someone this is actually our first time personally meeting, although virtually. Welcome, Toby Tabak. Pleasure to have you.
Thank you. The pleasure is mine. Thank you, Dvora.
So, Toby, you have run a program called WeeCare,
Hmm.
and we're going to get into the details of what the program offers and the support that it offers. But I'm going to begin our conversation with why did you begin this initiative? WeeCare is a program of support and supportive services to people who have babies in the NICU even after the babies have come home. So very often, as everybody knows, that the reason we kind of choose this thing that we're passionate about is because we have our own personal experience. So maybe you could take us back a little bit into what prompted you to create this kind of supportive network. What is your story?
Thank you. Okay, first of all, thank you for having me on. And this is a story that I'm very passionate about, so I'm excited for the opportunity. So I'm Toby Tabak. I live in Lakewood. I am 50 years old. So going back 10 years ago, in October, I gave birth to my youngest child. He was born in the 23rd week,
Mm.
a little over 1 pound. Um, we stayed in the NICU with him for about 4 months. He came home on oxygen support. He subsequently had to have surgeries, and we had to deal with ongoing until today many developmental delays and medical issues. So that is that in a very, very, very brief nutshell. As a result of what I went through, we decided to open up an organization to help support families and mothers of babies that are born prematurely or what we like to call micro preemies as well.
Yeah.
Um, at the time, it was my last pregnancy. He was my youngest. I had a whole family at home. And not only did I give birth at 23 weeks, but I was on bed rest in a hospital for 4 weeks prior to that. And it's important for us to understand this and to visualize this type of situation, what was going on, because so much of the stress and the crisis and the drama and the trauma, again, was what motivated all of us to start WeeCare and address the little pieces and the many layers of what prematurity can bring. Um, so this was my last pregnancy, my last birth. The birth before that was a stillborn, 3 years
Mm.
prior to that. So the doctors were being very, very extra cautious. They put me on bed rest for a number of reasons in the hospital, and we held out until the very first week of viability, which was 23 weeks. They had to intubate him and resuscitate him immediately. I want to give everyone an idea of what a micropreemie is. That's any baby that's born between 27 weeks of gestation. His eyes were still fused shut. His skin was completely transparent. The width of his thigh was about the width of this pinky finger.
Mm.
So extremely, extremely, extremely tiny. Um, and he was given a 50% chance of surviving that first night, 50% chance of survival. And this is actually quite new, Devora, because going back like 20 years, they wouldn't, depending on the hospital and the state and the rules and regulations, they wouldn't have even revived a baby that was born so early,
Right, right,
you know?
right.
So just to give you an idea of um, how frightening it was. And I remember we had a C-section. They brought me the baby immediately. He was already intubated. I didn't hear him cry. And I apologized to him. I said
Mm.
goodbye because there was no way he was going to survive in my mind. And I said, Shafala, I tried. I really tried my best. I'm sorry. I sort of apologized to him. And they whisked him away. It was an unplanned C-section. It was very traumatic. My husband wasn't there. My body was completely depleted and exhausted from being on bed rest. It was very, very, very scary and frightening. But here we are 10 years later, and he's in a mainstream yeshiva, and he's doing really, 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 really well. Um,
I want to take us back just a little bit, especially because so many of the people that are going to be listening are going to be fairly familiar with some of the reasons why someone would be on bed rest but they may also not be familiar with the reasons why someone might be on bed rest. And then I want to talk about viability. So whatever you're willing to share, what was the reason that you were on bed rest for 4 weeks prior to the birth?
sure. Okay. So again, I had a history, and I had gone in for a checkup, and the doctor, for some reason, decided to give me an internal, which normally they wouldn't, but again, because of my history. And they found out that my cervix was pretty much very thin at the time. And he rushed me into the hospital hoping that he could give me a cerclage. For those who don't know that, that's a stitch where they try to keep the cervix together. Um, Looking back, it was really a weak attempt to do something that they really couldn't have done. That procedure, by the way, for those of you who are listening who have gone through it, was extremely traumatic. You know, they basically lie you upside down in an OR with your legs spread across. And I had some wonderful nurses in there with me. And again, this is all unplanned and this is all happening and unfolding with absolutely no concept of preparing emotionally, physically, spiritually for this. I was not laboring then, I was not having contractions, but for some reason my cervix was very, very thin, as if I would be. And they strapped me into a bed to monitor me. Interestingly enough, bed rest is sort of, I don't know if you're familiar, controversial these days.
Right, right.
Not every, most OBGYNs at this point are not so pro it. And one doctor even confided in me that one of the major reasons what would motivate him to put a mother on bed rest in the hospital is because he doesn't want to deal with the mother's guilt afterwards. He
Oh,
feels that,
wow.
yeah,
Oh, he was
interesting, right?
honest and open with you about that.
Very
I,
honest. He
I thought
feels,
you were going to say that didn't want to deal with the constant calls from the mother at home. Like that he didn't
no,
want to be like dealing with her on a constant worried,
not for
anxiety
himself,
driven
but for the mother's
into
guilt. That the
right.
mother knows
Wow.
that she did what she could and
Wow.
won't have regrets and the constant guilt and,
Yeah.
ruminating about could have, should have, would have, but didn't. But studies are showing that bed rest actually could be very detrimental. It's very stressful and it could create blood clots. And really, truly, unless we're talking about a situation which is highly, highly dangerous, like the mother's bleeding or some other like really high level risk, um, you can't really stop your body
Right.
from
Right.
having a baby. Like when God wants you to
Right.
have a baby, you could be like lying upside down. Like years ago, they would put mothers upside down.
Right.
If that, it's hormonally induced. Like if the baby wants to come out, the baby's coming out.
Right. Right.
So what was helpful at the time is that I was in the hospital. They were able to actually revive him and resuscitate him in time. If I would have been home and traveling to the hospital, which was an hour away, God knows what could have happened.
Why a C-section? What was the decision to have a C-section?
So again, science and medicine is constantly evolving and changing, and as well as particularly in neonatal science, okay, because it's so new. Um, right after he was born, and I was literally shaking. My body was in shock from the C-section. I was being transferred back into my room that I was there for 4 weeks. Four doctors showed up and two nurses with tons of paperwork, asking if I could sign off on permission for them to study everything from my baby's urine output to his blood to whatever else, his entire story. And first, I was so overwhelmed. I thought it was such an intrusive, like nasty thing to do after I just had this baby. And my husband turns to me and he says, Toby, it should be a zechus for the baby that
Hmm.
we're going to
Hmm.
help.
Hmm.
It was just so new. It's just so new. So C-section at the time, they assumed that it was less traumatic for such severely premature babies.
Hmm.
That the C-section, that they felt at the time that labor and delivery would, that the baby couldn't handle it, so to speak.
Hmm.
Again, that's changed over the years, and it's so individual, Dvora. It's hard for me to really answer that
Sure.
question.
Sure.
Yeah,
So, and I think just want to clarify one thing because I think it is something that I have heard from, and I actually heard this from a client who talked about the positioning for the cerclage, and I just want to affirm what you just described in terms of being upside down, legs splayed, actually like in chains. She described it as being like
yeah,
hanging her feet in chains, her legs were in chains, hanging from like a actually upside down in order to pull the baby away from the cervix. There's no sedation. It's Laurel. It's just local anesthesia. And so I just want to be very clear that as you describe it is as it is, and it is something that had no preparation for it. Like there was
zero.
nobody who said to her, "This is what this is going to be like, and this is the things that you may feel, and I'm going to stand with you, or I'll be at your side," or there was none of that. It was just like we're going to do this because this is going to save the baby, or this will hopefully save the cervix from expanding further or thinning further. It was something I had never heard before until my client shared it with me, and it was so startling, and it sounded so archaic in how it was done,
Yeah.
and yet it seems to be the standard. So I just want to confirm and affirm as you described it as it is. Um, And
And
and I imagine that idea like that, by the way, that a C-section is one that would protect the baby in some way
mhm,
to give you a greater chance of resuscitation. I want to talk about resuscitation for a moment. Because that number is changing. I remember in my years, viability was 24. Like when my
right.
early training on a women's health unit, viability was 24 weeks. And if you were 23 and 2 or 23 and 3, you were not going to be offered any kind of intervention. It was basically you will allow the baby to die because the baby is considered non-viable. And these numbers have changed with time. I know Colombia is resuscitating 22,
Yeah.
which is extraordinary. And also, we have to be honest about what are the implications of kind of fetal resuscitation and extending the life of a child at that gestational age, and what are some of the kind of risks associated with that. So first and foremost, recognizing that depending on the state and the hospital is whether you'll even have the right to resuscitation. So you as a parent can say, I want you to resuscitate my 22 weeker, and the hospital might say, we don't do that. And we won't do that because we don't think it's in the best interest of the child, or this is just not medical practice. So that really is very state specific. And I just have to remind people that there's a deep interplay between gestational age of resuscitation and termination and abortion laws.
Yeah.
So, if the law is that we resuscitate, then the law would actually also be deeply applicable in terms of parental choice or non-parental choice, when it comes to issues of resuscitation, issues of does a parent have the right to say that we don't want resuscitation of a 22 weeker when the laws of the state are not necessarily aligned? There's just a lot here that when people think about termination or laws around abortion, they're not really thinking about how it might apply to resuscitation expectations or lack of expectation in the hospital in which they're delivering. So just something to kind of keep in mind. Not the topic for today, but definitely a topic worth talking about. Okay, Toby, come back a little bit about, you had the potential of a micropreemie,
Mhm.
and I'm wondering what your doctors were telling you about what the potential outcomes would be. Like if you make it to 23 weeks, if you make it to 24 weeks, what were they telling you?
Okay, excellent question. So I was laying 4 weeks on bed rest, and what they would do is every day, I wasn't sick per se, so it was just cute. This would be nice for you to know as far as you being a mental health practitioner. So there weren't rounds per se because I wasn't sick. They were just observing me. So the OBGYNs would come in and schmooze with me when they had time and downtime between births. I ended up becoming friends with all of them. I'm a pretty good listener and I'm very, very curious. So they would literally sit in the corner of my bed and talk to me because they weren't checking anything else other than whether or not I was in labor. And what they would do is that as time passed, and every week passed, they would tell me what my percentages are, coming closer to the 22, 23 mark. Why did I mention that thing? Because I felt very cared for, as lonely as it was being in the hospital, and as lonely and as challenging as it was being away from my four other children at home. The oldest, which was a senior in high school, and the youngest being in pre-1A, which I want to talk about later, the effects that it has in the family dynamics. And I went in for the cerclage on the first day of school. Um, so I had a team that I felt I was very cared for because they would just spend so much time talking to me. It was just, a pretty quiet hospital at the time, Robert Wood Johnson. Now it's exploded. It's much bigger with the growth of Lakewood. And I felt cared for and attended to. And I think that helped me when I did get to that place of giving birth so early, emotionally. I felt very supported and very connected to this team. So they would be telling me with each passing week what my percentages are and how much closer I am. And in my mind, Dvora, I was going to go to 9 months. I mean, there was nothing to talk about. I had friends making me a countdown chart, and I was making plans for Yom Kippur and for Sukkot and Hanukkah, and I was going to stay there until his due date. Um, the day before I gave birth, the neonatal team from the NICU came up to my room to tell me, okay, this is the first week of, hi, they introduced themselves. This is the first week of viability. Let me tell you what's going to happen. Let us tell you what's going to happen if you give birth tomorrow, literally. So I'm assuming that that's what they would have done, you know, as the as the journey of this, laying in bed would have proceeded. They would have come to me each day or each week, giving me an update. which
Hmm.
again, going back to the emotional mental piece, that preparation was so vital, so important, so huge. But I remember nodding my head and listening to them as they're going through the percentages and they're giving me my steroid shot and they're talking to me and they're schmoozing like, no, they don't get it. There's no reason for us to have this conversation. I'm staying here till Hanukkah, right? Literally the next day, 5 o'clock in the morning, I go into labor. I'm rushed into my C-section. And I see those same four faces, and this female neonatologist who is just a sweetheart pulls her mask down and says, I didn't expect to see you so soon. She had literally just met me the day before.
Mm.
So they do prepare the moms at that point, with information. So I had a little bit of an inkling of what to expect.
Now, when you're being told this, because I've heard this from the clients there that I've worked with, there's a lot of there's a lot of realistic data that they give you about like, percentages in terms of like that the baby will survive. But then there are
Mhm.
also a lot of very, very frightening information about there's this percentage of the chance that the baby will be blind, this percentage of the chance that the baby will be developmentally delayed, this percentage of a chance that there'll be strokes, in the baby's brain. What were some of the things that they were sharing with you? Did you hear that as well?
I didn't hear that and it's interesting. I don't think I'm not I'm not denying what your clients told me, but I was never given a rundown of anything. I think Google helps every mother with that.
Sure.
And I think every child is so, 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 so unique, and everyone's NICU journey is so unique. I can't, they just gave me the basic statistics as far as survival. And when I called up my pediatrician, who I was close to at the time after the baby was born, he was the one that sort of said, Toby, this is going back 10 years, how many 23-weekers survived? He was the one that was more, because we're friends, we're close family friends. He was the one that told me, Toby, it's going to be hard, it's going to be rough. There's
Mm.
just so many issues, but I'm going to be here with you. He just kept on saying that. No statistics, no numbers, but just the only thing that they shared with me was the rates of survival and how slim the chances are, and with every week of gestation, how much the survival rates increase and how much of the complications decrease, so to
Hmm.
speak.
Hmm. Well, did anybody have a conversation? And I know that it's possible that culturally they were not going to have this conversation with you, but was there anybody that said you might want to consider like to allow the baby to not be resuscitated if you
No,
give birth before viability?
no,
There was no
no,
discussion of that.
no
Hmm.
discussion. And as far as I know, they really, really, really attempt. Most of the women that we help and we care, they really try starting from 22 weeks to really, really attempt to resuscitate and revive. I mean, we have one of our first clients was a woman who gave birth in Jersey Shore, and she had a 22-weeker. 22-weeker baby is in her baby. Her daughter's in grade school now. She's doing
Hmm.
pretty well considering, and she was the youngest surviving micro preemie because these babies can survive, but not always will they thrive, and not always do they survive the NICU journey. There's so
Right.
many stages and pieces of it. We've had so many, unfortunately, it's very common for again, the younger the gestational age, the risk of death just increases. So
Yeah.
we've unfortunately have held the hands of many moms who the baby survived the first 2, 3 weeks, and then unfortunately they pass away.
Right.
But so nobody told me anything, and they didn't ask me per se, and they just attempted right away. And you know, he was just whizzed away and taken into a special type of incubator, which they put these micropremies in, because somebody realized a number of years ago, a doctor noticed that these babies were not surviving, and then he realized that their skin is so transparent and translucent that they were losing fluids literally from the operating room to the NICU.
Mm,
So for
mm.
the first week of life, they're in an incubator, which is sort of like a sauna, like a steam room. So when he was born and put immediately into something that looked like a Ziploc bag, like up to his chin,
Oh,
to able
wow.
to retain those fluids that he doesn't dehydrate.
Mm.
That's how thin and transparent. You literally saw his veins,
Sure.
um, and then they whisked him away. And w without even asking me, once I recovered, I was in the recovery room for a short while till they made sure that I was stable. They took me in an elevator on my bed into the NICU to see my baby. And
Really?
the reason why they did that to do that is because the chances of this baby surviving is so slim, and they wanted me to see him. So I'm lying there on this huge stretcher being wheeled in, and there's a team of like 30 professionals,
Wow.
like standing over this incubator. And they're like, Mommy, you want to see your baby? And I said, No, 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 just do your work.
Mm,
Just save him, set him up. I
right.
don't want to interfere. Like, do your thing, you know?
Mm.
So we had a hospital that was extremely kind and accommodating and understanding of his fragility and of how high risk he was and how high risk mommy's feelings were, you
Yeah,
know?
I love hearing good medical practice. Too often we hear of like the worst, terrible, awful people care. And it's wonderful to be reminded that there are absolutely other outcomes. You just don't usually hear about them on podcasts. So it's good to hear like they really did right by you and they really attended to you as a woman, as a mother of like, even though you were medically fragile, just from having just had major surgery, that you're like, we want her to see her baby alive and that there's value in that for her and that a woman would appreciate and want that. And I commend the team for acknowledging that somebody did a good training. Somebody taught them right.
Yeah. It's
Yeah.
also, you have to understand where in my life I was when this was happening. I was
Mm.
40. I had a bunch of kids. I've had a miscarriage. I've had a Moldor pregnancy. I've had a stillbirth. I had some experience
Mhm.
and, whatever therapeutic process I had to go to get through that. And I think experience and time and life, and also the way I was raised and my faith, it helped me have a more positive. I'm not minimizing the trauma. We'll get into that in a minute, but it helped me want to focus on the good, not just focus on the good, but want to see the good. Like, for instance, you're talking about the cerclage. I was sitting there upside down, and there was like a team of men trying to stitch my cervix. It was brutally humiliating. And there was this nurse, this unbelievable nurse. I keep on trying to track her down 10 years later.
Mm.
Very, very deeply religious Christian nurse who took me in, and the entire time she was whispering in my ear, saying, I know this is mortifying. I know this is embarrassing. I know this is hard. I promise you, they don't even realize it's a vagina. They have no idea that it's a cervix. To them, it's like bread and butter. You're going to get through it. Let's talk about your kids. Talk to me. And spent the entire time trying
Wow.
to distract me and going on and on. I know you're a religious woman. I know you're uncomfortable. I know you're horrified. You're going to be okay. Your baby's going to be okay. And so I automatically latched on to that goodness that was there because I feel like there always is. There
Mm.
always is goodness and kindness and Hashem's chesed in every single situation.
Mm.
Because I've been in situations in the past where I did it and it completely fell apart. But people are overwhelmingly kind and nice. And I try very hard to focus on that. And that helps shift a really crummy situation into something that's bearable and tolerable. I'm speaking for myself.
I think what you're also acknowledging is that it was still really difficult, and really crummy and really intolerable. And yet there were these like, in sometimes in like in trauma therapy, it's the idea of like, was there a bright light? Was there someone, something that if you expand your view of the scenario, was there someone there that you might acknowledge was the bright light for you in that moment? And it doesn't take away the trauma, it doesn't take away the implications of what you have to live through, but it reminds you, as you said, that there's a different view, there's a different perspective that you can sometimes like kind of hold as a form of support or connection, kind of grounding in some goodness. I just appreciate the honesty in that.
Sure.
Do you remember the first time you saw the baby?
Yes. Okay. So, other than when I was in the recovery room, when they took me to see him, and I just said, no, take care of him. I'm going back to my room. Um, I actually gave birth the day before Yom Kippur. Yom
Mhm.
Kippur. And so it was very hectic. I had kids at home. Besides for this baby, I had to deal with my children. We weren't being home from Yom Kippur, obviously, so setting them up. I had four other children at home. They were in Lakewood. I was in Robert Wood Johnson. So we had to deal with that. And of course, it was post C-section. I was in a lot of pain once the initial drugs wore off. And they told me that he was stable, right? There is this a few hours or a few days after the baby's born that sometimes, even in the most difficult scenarios and the most critical, they do well. They're still flush with their mother's hormones, and there's some adrenaline there, and they do okay. It's not indicative of what they will be doing like in a week from them, but so he was stable. They were able to stabilize him, and they were working on him, and I heard that, so I busied myself with taking care of my kids and arranging Yom Kippur for my husband who was with me. And so Yom Kippur at night, my husband went to daven a little bit and he came back to me and said, I'm going to take you to the NICU to see the baby. And I was all excited. And of course, I ate my Yom Kippur meal Friday, the night of Yom Kippur. And I was just very excited about it. And I think I was in a little bit of denial, not so much, but a little bit, which is a great coping mechanism, by the way. And my husband wheels me down to the NICU, and they told me your nurse is going to show you the baby and introduce you to him and see him. Of course, not hold him. I didn't hold him for the first 2 weeks, but to see him. And as she's there, I see she's very stressed and very distracted. And there is this team of doctors and nurses hovering over the incubator, which were a few feet away from ours. So you're not in your own cubicle. There's no division with partitions or anything like that, but they're very far spaced from each other. And they're just hovering. And I see the nurse is distracted when she's trying to talk to me. And I said, sweetheart, is that your baby that you're watching too? And she said, yeah, he's in a little bit of a crisis now. I said, okay, go take care of that baby. Do you see my pattern here? Okay,
Mm-hmm.
take care of that
Mm-hmm.
baby. I'm an empath. I'm sorry. Go take care of that baby. We're going to be here a while. I could talk to my baby. She says, okay, thank you. Could you give me a few minutes? And I noticed the parents of that baby were with me. We were both being wheeled in for C-sections at the same time. I had overheard it in the thing. We were both being wheeled into C-sections at the same time. So we literally gave birth minutes apart. And she's going to take care of that baby. And I'm sitting there and looking and trying to take in this thing. He didn't look like a baby to me, but this thing that's lying there, not really having any attachment or any feelings. And there's just so much noise and sound and, drama going on next to me. And all of a sudden, they're calling code, whatever it was, code blue. And before you know it, the baby dies.
Oh.
The baby dies. And this is unfolding in front of my eyes. And I look back at this thing that's in the incubator that's supposed to be mine. And I turned to my husband and I said, take me out of here. Take me home. Take me home. And I stopped crying. I said, I've been away from my kids for 4 weeks, the ones that are normal. I remember saying, the ones that don't look like this. I don't want to get attached to this. This is just a thing. I don't know what it is. I can't deal with that. I can't deal with that. That I can't deal with. I'm good at a lot of things. I'm not good at a baby dying. And I just started screaming, just get me out of here, take me upstairs. I don't want to be here. And the nurse comes back, let me get you another nurse. I said, no, honey, I'm fine. You go take care of those parents. And he wheeled me upstairs. And that's when I just broke down and just
Oh.
realized how huge this is and how scary this is and how big this is. It hit me then, you
Yeah.
know?
When we teach about NICU parenting, there's a word we use it says it's an exposure to multiple traumas. And
Mm,
that's exactly what you're speaking about. That NICU parenting is one where it's not only your own story, but it's a story of the bed next to you. There
hmm.
has been some modernization in some hospitals where you actually
Yeah,
have a private space and a private room. Some of the micro preemies especially are in their own spaces. Depends on the severity of the hospital system that you're in,
right,
that they care for. But what you're describing is one of the biggest risks, I think, of NICU parenting. It's not only your own story, it's the story of others. And
right.
that is, I can't imagine how complex it was for you to experience that the first time you got to try to meet your child is to the death of one right next to him. How deeply painful and frightening that is. Yeah.
Right. So, you know how it is after a C-section, so you're given like another week's stay,
Yeah.
which in the way was a big blessing, because I was able to, over that time, have like nurses help me go down to see the baby. So the next day, I gathered myself together and I became a little bit more calmer and I took a couple of nice pills and I let my husband go daven. I said, "You go daven. We need this now." And I had a nurse take me down
To daven just means to pray for those of you
to
who might
pray. Oh,
not be
I'm so sorry.
familiar.
To
That's
pray.
okay. We
It
can
was
just
Yom
translate.
Kippur. Yeah.
Yeah.
And it was very overwhelming. There's a tremendous amount. And this is, when we talk about week here, we're going to, I consider myself an intelligent person, a well-read person, a knowledgeable person. You can't even imagine the medical jargon, the information, you can't even process it. And the way it works with a micro preemie or preemie that's really critical is that my baby saw more specialists and more medical professionals in his first week of life than an average person sees in their lifetime.
Hmm.
Because people have this misconception that, oh, they just have to gain weight and it's just a breathing issue. But when you're born so early, too early to exist in this world, all your systems basically just collapse. So you have the huge issue, which is the breathing, which that affects, cardio, the heart. And there's an issue with the eyes. There's an issue with the intestinal issue, with gastro issue. You have brain bleeds, like you mentioned before. And you're dealing with the 1 pound human, you know, and everything. And again, the science at the time, and it's still evolving and new. For years before, they felt, let's say, just blast the baby with oxygen, just blast the highest amount of oxygen. And they realized they still don't know why. But too much oxygen could create blindness. There's something it's called ROP, and they develop scar tissues on their nerves, on optical nerves. So there's this dance that they're constantly doing, this like delicate, like equilibrium of systems that they have to manage, which God is managing in our bodies every minute of every day.
Right.
But here, this baby was supposed to be formed, you know, and it's not, it's half baked. So there's so much, and it's minute by minute, sometimes by second. So
Hmm.
it's not like another medical crisis where a child is diagnosed or a parent. I'm not minimizing that, but, and there's some sort of trajectory, and there's some sort of like, okay, let's have a conversation about what treatment we're going to be doing.
Sure.
Okay, let's make a decision if we have to change hospitals. Okay, we want to be, we don't like this approach. Let's go for a different approach. Just as like boom, 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 boom. This not only is scary, but it gives a parent a tremendous sense of powerlessness. Like
Hmm.
there's no decision making, and there's no logical decision making, and there's no time to make decisions. When they call you from the NICU, they're telling you this is what's happening to the baby. This is what we're doing now. Imagine an ER, imagine triage. That's what's going on for the first few weeks of life, and it's just coming at you fast and furious. So for me, the decision that I did, once I heard from my pediatrician that it's a high level NICU and just trust the process and trust the doctors, it was hard for me, but I did just take a step back and just said,
Hmm.
I'm here in any way you can.
What's
And I'm
interesting
not,
though is, oh, sorry, go ahead. And that you want to finish that
and
statement.
I didn't undermine them. I didn't question them. I just realized right away, okay, Toby, this is just do your thing. Just go pump. We'll talk about that in a minute. I pumped for 6 months. Go pump, provide the milk, show up, sing to the baby, let the doctors do their job. A lot of the mothers, and especially Jewish moms, don't really go that route. There's a
Hmm.
tremendous amount of mistrust sometimes, which I understand, and this need to advocate, which I can understand. And they sort of want to be involved in every decision, and and that I'm not judging them for that. I'm just saying that it's just a tremendous amount of stress. There's room for advocacy, and we encourage our moms to advocate. There definitely is. But I'm just sharing my experience at the beginning when I saw that it was just too much for me, and just, okay, just do your thing. I'm here to support you.
I think also what you're speaking to, very often in trauma-informed care, the perspective is always about giving parents choice. And
Right.
what I'm also hearing is that the reality is that there really aren't very many choices, meaning the doctors are telling you this is what we need to do. There's not like three options. It's like,
Right.
this is the way that we are going to try to care for and help your baby survive. And that could be very disorienting to a parent who's trying to be like, well, can I be involved in the decision making? Can I be involved in the choices? And yet, maybe there aren't that many choices when what we are dealing with is so niche and so particular to this child. There aren't three options. There's barely one. It's a fascinating perspective in terms of acknowledging that that lack of choice can be for you, perhaps in some ways there was comfort in that, or there was choice in that, and be like, I'm going to trust my physicians to do the best they can. But there could be deep discomfort in it for somebody who's very
Huge.
used to being very
Huge.
deeply involved.
Right.
Yeah.
Huge.
Yeah.
The layers of trauma with having a micropreemie, it's just like it doesn't end.
Yeah.
It
Tell
just
me more
doesn't
about that.
end.
I want to talk about that trauma.
Okay, so first of all, let's start from the beginning. What's the most obvious? A mother has 9 months in a standard, typical, healthy pregnancy to prepare emotionally, physically, spiritually to give birth to a child. There's 9 months, right? So you have the shock of all of a sudden this coming out of left field, unplanned and unprepared for. So there's this complete shock. So whether you're newly married or whether you have a family with children, this comes out of left field. Now, Dvora, majority of medical crises come out of left
True.
field. But there's that next layer. But most of those crises don't happen when you're pregnant or postpartum.
Hmm.
So as you know, because this is your specialty, when you give birth to a micropreemie, you are depleted emotionally, physically. You're just exhausted. Your hormones are out of whack. Your body responds to this birth like any other birth, right? Your milk is coming in, the hormones are out of whack, you're completely nuts. Majority of them have a C-section or have been through a difficult number of false alarms and cerclage and treatments and things like that. IVF is a very high trigger for these type of for micropreemies and preemies, so there's history. So you're not prepared, and then you're going into dealing with this extremely challenging medical crisis, not being physically strong at all,
Hmm.
not being
Hmm.
physically strong at all. And when you have a typical postpartum situation, you're being cared for, you're being doted on, you're
Hopefully.
being, hopefully, you're being held to some extent, or at least you could give yourself a little bit permission. Then comes the urgency of being there for your baby at any given time. So you have that almost, if you try to wrap your brain about it, anyone who's in maternal mental health or women's wellness, it's just horrific. It's just horrific. And so then you're led into these medical crisis, which for the first few months, for the first few weeks, it's just touch and go, touch and go. You know, you have moms that come home for the NICU, they settle themselves down, the doctor calls and says, we have a crisis, they're back in the hospital. You know, so you're just overwhelmed. Then you have the feelings of, so you have a tremendous amount of anxiety and fear, tons and tons and tons of fear. There's also comes up immediately the guilt, you know, the constant guilt. So you have the guilt about how I got here to begin with. Maybe I should have laid, maybe I should have gotten to the doctor earlier, maybe I should have used someone high risk, you know, they're constantly beating yourself up. And then comes the guilt about your current situation, you know, which is tremendous. Should I be at home or should I be in the NICU? If I'm in the NICU, I want to be at home with my other kids. If I'm at home with my other kids, I'm feeling terribly guilty that I'm not in the NICU bonding with the baby. There's also this tremendous, tremendous, tremendous fear of the loss of attachment, you know, of bonding with a baby. We could talk about that soon, which is so huge. And because it's so popular now and it's such a hot topic, the mothers go crazy. You know, they're basically projecting this kid is going to like be a drug addict because he didn't bond with me, right?
Right, right,
Or he's
right,
right.
right,
So they're
right.
going there immediately. And also it's and then comes the grief and the mourning and the loss of being able to bond with your baby, nurture your baby, feed your baby. So there's just so many elements. You're dealing with the kids at home. The kids at home know that they're this sibling that they never met. They're davening for, they're praying for, or they're missing because they're very, very strict in the NICU. I'll get to that in a minute. And you're trying to calm them down and you're trying to not alarm them. So you're just being pulled in so many directions. And then your typical average struggles that come up with any crisis, which is the effect on the marriage, you know, the struggles that you have with family or friends not really getting it. And of course, the shame of needing to depend on so many people to help you
Mm.
out.
Talk to me
Yeah.
a little bit more about what you put everything out there so perfectly. Really, really touched on so many different pieces, each of which can have its own conversation. But I do want to narrow in a little bit on the children that were at
Yeah.
home, right? You
Yeah.
had some big kids and some little kids, and
Yeah.
I'm wondering about how you presented this conversation to your children. Obviously, going into the hospital, it's a little bit easier to say, like, I'm doing this to help the baby grow properly.
Right.
But once the baby's out and the baby is really, really quite fragile and quite unwell, what is the languaging that you used other than pray for the baby? Because I imagine that there was some level of we need to have a straight talk with our kids about the possibilities and the percentages, perhaps, or perhaps not. What was your approach?
So you want to hear something hilarious? I prepared myself for when I came home after I was discharged to sit down with them. They're going to sit around my bed and I'm going to have a frank conversation with them and meet them where they're at. And I'm going to be, you know, I spoke to so many people of what sound bites I should use and how to be an empathetic listener. And I was told everyone's going to react differently. And I was just so excited to like okay, you know, this is parenting challenge number 6,742, and we're going to do it, right? And I come home, and my husband puts me into bed, and my kids come swarming to me, and I said, I want to talk to you about the baby. And the only thing they wanted to talk about was everything else because they hadn't seen me for 5 weeks.
Right.
Like, just, Ma, what's gonna be? I need a new pair of glasses. Ma, Chaim was driving me bananas. He's totally nuts. Ma, what are plans for Halamite? Ma, I don't have clothing for Yom Tov. This showed me so much about how children crave and miss because my situation was different because I was out of the house for 5 weeks, but it's just indicative of how kids just crave and when they don't have it, miss routine and normalcy.
Yeah.
So they
Yeah.
were just so excited. Like when they heard that I'd given birth, my 12th grade daughter, who's brilliant and successful and smart, my son tells me that she heard the news and she goes, Mazel tov, congratulations, mom had a baby, yay. And my son screams, because this is 5 in the morning, screams from the other room, how do you know that the baby's not missing eyeballs? Why are you so excited? She said that she just wanted me home.
Oh, yeah.
She
Yeah.
just was so excited that that very challenging part of her life was over.
Yeah.
So what we have consulted with many different professionals, and what we have been guided to do is just keep it simple, don't embellish, don't make it so tragic, don't make it into a
Hmm.
whole crisis, don't make it about you, don't put your fears onto them, and just it has to do, it's age relevant, it has to do with, this, about what they could hear and what they can't hear, and be open to their questions. And it's okay if you don't say, if you could say, I don't know and I'm not sure. And most importantly, don't put the pressure on them to feel responsible for this baby. That's a huge,
Hmm.
huge piece. And because I had children that were siblings of this NICU baby at WeeCare, it is so important for me to validate what they're going through that we have a tremendous amount of sibling programs.
Really?
The NICU, what I observed when I was there, is very, very isolated part of the hospital due to the nature of its patients,
Hmm.
right? Especially now after post-COVID, forget it. But all the other normal visitors that would come to do chesed or kindness or good deeds, Bikur Cholim, Chai Lifeline, all the other organizations have zero access there,
Hmm.
zero.
Hmm. Hmm.
So here you have a child that's critical. You're not getting support from all those typical organizations that would have been for you and your family. The baby could stay from 3 months to up to a year in the NICU. The kids are at home. No one's acknowledging them. No one's acknowledging
Yeah.
what they're going through. They're on this terrible roller coaster together with you. And so we really acknowledge that. We make sure to send out gifts to the siblings. We make sure to send them lots of swag. We are in the midst of publishing a book addressed to siblings of preemie babies. We just put out a coloring book, which has, according to the alphabet, different, explaining different medical terms in a child-friendly way. I'm just so super sensitive
Yeah, I
to
hear it.
having
I hear it.
children at home,
Yeah.
you
You
know?
know, I feel like we can take this conversation in many different ways. I'm mindful of our time together,
Sure,
and there may have to be a part two because there's much here that I think needs exploration. Um, I want to give two things. One, I want to talk about pumping because you talked about
sure,
bringing that up again, and I want to talk about that and the choice to pump, and for some parents, the difficulty in pumping, and also the guilt that sometimes comes
sure.
along with it of the feeling of like I have an obligation, even though it could be really, really complex. And then we're going to finish off with the misconceptions that you want people to understand about the NICU parenting process. So let's start with that. And I want to talk about WeeCare. I want to get a little bit more into the details of
Sure.
what you do provide. Okay, so let's do pumping first. Talk about that decision or choice.
Yeah. So it's huge. It's huge. The pumping is crucial for the baby. I'm sorry, I shouldn't say pumping. Let me rephrase that. Breast milk
There you
is
go.
crucial and critical for these babies.
Yeah.
Their digestive systems are extremely, extremely, extremely sensitive. Remember, I spoke to you about that delicate like equilibrium of like treating, but at the same time, the treatment can challenge. So these babies must grow. They must grow. They must gain weight, right? The organs have to develop. Um, but they realize that if they're not feeding them in a certain way, in a certain system, literally, I don't know any other way to describe it, but their intestines would explode. I'm
Mm.
helping a family now. I forgot even to talk about loss, the percentages of loss. But this is a mom. She has a 2-year-old at home. She gave birth to triplets in their 24th week. Unfortunately, after week one of the triplets passed away. And Dvora, talk about trauma. She didn't even have time to process that or deal with that because she's busy with two other babies that are critical, two patients that
Right.
each have their own separate, right? And now one of them just developed NEC, which
Hmm.
is the acronym for, I'm not even going to try to say it, but basically where the intestines develop ulcers and wither, and they have to literally cut, imagine a 2 pounder. They have to
Mm.
cut out pieces of the intestine, right? So, and she's pumping, by the way, which is good to share because we do the best we can, but we can't really control the outcome. So the breast milk has been studied to say that it is just more appropriate for a preemie or micro preemie's system, and so they encourage it a lot, a lot, a lot.
Hmm.
However, as you know, not every mother is cut out to nurse, and especially not every mother is comfortable with pumping, and especially when there's no alternative. The beautiful bond and the way that God created our bodies with the letdown and all that happens when the baby is sucking, when there's the skin to skin contact. So you're basically robbed of that and you're expected to pump. Even for someone like me, I nursed my kids till they're 2.5. So this was huge for me. And the milk came in easily, but it was just so hard. They put you in this little cubicle, you're usually watching TV. There's these two things stuck to you, and there's the beeping of the NICU in the background, and you're anxious and you're tense and you're tired. So it's really, really, really rough, even for someone like me that didn't mind the pumping, you
Right.
know.
Right. Right.
So there's a lot of pressure put on that. Thank God there's a lot of milk banks now
Hmm.
which provide that. Um, the message, though, that I like to tell mothers, especially through WeeCare, is your duty and obligation as a mom is to make sure that your baby is fed.
Right.
You know,
Yep.
I know they're pushing breast is best, but your duty as a mom is to make sure that your baby is fed. And some mothers, a large majority, end up that their babies come on home on G tubes and NG tubes and pegs. So forget about nursing for them ever. But your job is to make sure that your baby is fed. That is a mother's job, whether it's by bottle, by tube, or by breast. And I think the more that we tell that to ourselves and ourselves of that, the less guilt we're going to feel. There is a sense of loss for those who can't, they have to deal with that. But today we have milk banks, we have options. They somehow screen the milk and they make sure. So if you can't, my message is that is okay. That
Yeah.
is what's meant to be. That is what's best for your baby because your sanity and your emotional regulation has to be like priority. Because if you're not going to be normal for this child, that's much more detrimental than if the child got mother's milk or not. And look at this woman who's pumping beautifully. And even with that outcome, her baby still developed this horrible condition. So,
Right.
again, a mother's obligation is for a child to be fed. Not,
I love hearing you say it. It's what we teach. It's so critically aligned with mental health. To clarify there that the neck is a diagnosis that they've been significantly able to reduce it
yes,
by
yes,
providing the breast milk, which is what you're talking about. But I think that you're completely accurate in that fed is best and donor milk is available. I am hearing from several different NICUs that they only provide breast milk to babies. Like they
yeah,
will not provide. So even if the mother cannot provide breast milk, they are requiring that it be given from another mother and another person who's providing breast milk, which is just gives you the sense of like maybe the language can shift a little bit more about fed is best and this is how we feed our children. But you are correct in even from a even somebody who doesn't necessarily struggle with mental health issues, these are things that are going to become big feelings and we need
sure,
to honor them and
absolutely,
respect them
absolutely.
exactly as you described.
And
So,
and it was hard for me. I make it sound like I have it all together. I cried because I was such a nurser.
yeah,
And instead of congratulating myself and patting myself on the shoulder for pumping for 6 months, which is huge, I was
right.
busy grieving and beating myself up and frustrated that he couldn't latch. A lot of these babies have oral sensitivities, and a lot of them reject food. And, we went through
Mm,
that. I mean, it was
so
craziness when we come
much.
home.
Right.
But if I would have just said, hey, hooray forget about hooray that I pumped for 6 months, hooray, period.
Right. Some
Hooray
celebration. Right.
hooray for Toby, period, and acknowledged what I was doing instead of what I wasn't doing for this child, I would have been in a much
Right.
better place
I
mentally.
hear it. I hear it. Talk to me about We Care. Tell me
So
what you
yeah,
do.
we saw that there was this void and we couldn't believe it. As neonatal medicine improves, as fetal medicine improves, and as more of these babies are being born for different various triggers, whether it's IVF and all that, reproductive medicine improves, more and more and more of these babies are being born in our community. I mean, we're up to like between 10 and 12%. And we couldn't believe that there was no support for this. We couldn't believe that there was no dialogue going on outside of the NICU about this. And we felt very strongly, me and a few mothers, one of them being my sister-in-law, who also had a micropreemie, that we should start out. And we started out saying that we're just going to support them from the medical end, like just help them go through all the diagnoses and the terminology and the jargon. And then we ended up, deciding that we're going to do a lot of wraparound services. So depending where you are, we do meals and we provide rides to the hospital. And ultimately, which is really our crowning accomplishment, is the tremendous amount of emotional support. And for those who are watching, we had Dvora Entin on recently, where we interviewed her talking about postpartum trauma, which is, of course, so linked to prematurity. So we do a lot of these support groups. We do a lot of peer-to-peer. We have a lot of NICU professionals and paraprofessionals come and talk to the moms, and we do 2 or 3 events a year where, depending where you live, we gather the mothers together and we sort of celebrate them. So basically, it's holding your hand throughout the process and guiding you in many different ways through this
Wow.
really, really challenging journey. And the NICU journey doesn't end when you discharge. Then there's that whole other layer, which they don't really prepare you for because you're so busy just keeping this baby alive. And then comes 2, 3, 4, 5 years of all the developmental delays or medical issues that a lot of these babies have. So we hold on to some of these moms till the kids are 6, 7 years old.
How can somebody find information about WeeCare? What's your website?
www.wecarepreemies.com.
And it's
We is
WEE, right?
WEE,
Like
the
little.
tiny.
I love it. What are some one or two misconceptions that you want to get people to understand are wrong? What are some of the misconceptions about NICU parenting?
Never say, "Oh, your baby survived. What a miracle."
Mm, mhm,
Don't say anything. How about that?
Right.
Just smile and say, "How are you?" or "I'm here for you." What are the
Hmm.
misconceptions? It's not just a baby needing to gain weight and learn how to breathe on its own. It's so much more than that. And
Hmm.
it doesn't end, another misconception, it doesn't end once you're discharged and come home. A lot of the mothers complain that they got so much support when the baby was in the NICU. And then when their baby was home for the first time, when everything hit, and there was so much more, that they were sort of abandoned by their community and by their family.
Yeah.
It doesn't end, it's just the next stage. And moms really need a tremendous amount of hand holding at that time,
Yeah.
particularly in that time, because the adrenaline wears off and all of a sudden it's like, what just happened?
And it's also all on you at that
Yeah.
moment. And it becomes all you don't have the nurses and the doctors on the phone right there next to you coming running in to help. So there's a lot there. One last question for you. We are talking about moms. What about the dads? Have you been able to engage with fathers at all on these issues? Because we know it impacts them perhaps differently, but similarly and still traumatically.
Excellent question. I have such a soft spot for men because just watching my husband, who was being pulled in so many directions, needing to hear from me, my kids at home, being there in the hospital, it's
Yeah.
huge. And of course, WeCare understands that. We do a lot of peer-to-peer support, and a number of times we've arranged for phone and virtual support groups where we have community leaders talking specifically to the husbands and guiding them and validating them and empathizing them. It's tremendous on them because having a baby is hard on a dad in general, the
Yeah.
financial responsibility, someone else that they need to take care of the wife. So this is just tremendous for them. So of course we address them. This is tremendous. And so we talk about supporting We Care families, not just We
Beautiful.
Care mothers.
Beautiful. Toby, this has been a treat. I really appreciate this conversation. Thank you so much for
My
being a part of
pleasure.
it.
Thank you, Dvora. This has been a real privilege.